BRAF and MEK inhibitor targeted therapy in papillary craniopharyngiomas, a cohort study by Day Alkabir et al. Background: papillary craniopharyngiomas are rare tumors of the pituitary region, with 95% of cases being driven by V600E BRAF mutations. Combined anti-BRAF MEK targeted therapy is an emerging potential treatment, but standardized data on large cohorts are lacking. The aim of the study was to assess the safety and efficacy of targeted therapy in patients with PCPs. This was a retrospective national multi-center study comprising 7 centers in France. Patients with V600E BRAF mutations treated with anti-MEK BRAF targeted therapy up to July 2023 were included. Volumetric MRI, clinical and hormonal assessments were performed at intervals from baseline to last follow-up after definitive treatment. Radiological response was broken down and recorded as 5 categories based on percentage volume reduction or increase. The age of the cohort was 50.5 years, with an equal proportion of males and females. 6 patients received neoadjuvant therapy, 8 received adjuvant therapy, and 2 received palliative therapy. Symptoms prior to targeted therapy included headache, endocrine dysfunction, visual impairment, weight gain, and cognitive dysfunction. 93.7% of patients exhibited partial response or higher at the end of treatment, and at early evaluation, cystic and solid tumor components showed differential susceptibility to targeted therapy. At last follow-up, however, the responses of cystic and solid components were similar. 62.5% of patients reported no adverse effects during treatment, however 5 patients had to discontinue treatment due to adverse effects. Targeted therapy in PCP patients can induce impressive tumor volume reduction and clinical improvement within a few months of initiation, however adverse effects warrant careful monitoring. Medical debulking should replace surgery in invasive PCPs, however further research is needed to elucidate the optimal duration of therapy and timing of radiotherapy after medical therapy. Scan here to read the full article.